Acute myeloid leukemia Part 3. Feel free to pause the video to give yourself time to answer the questions. Please note that this information is based on the 2016 revision of the WHO. What cytogenetic abnormality is common in AML seen in infants? KMT2A, which was formerly known as MLL, rearrangements. KMT2A is located on the long arm of chromosome 11. Translocation 411 is the most common translocation in infants. In what AML-associated translocation are basophils commonly seen? Translocation 69, resulting in the DEK-NUP214 fusion. Marrow and peripheral basophils are seen in 44 to 62% of cases of AML with translocation 69. TDT is expressed in approximately half of the cases associated with what AML translocation? Translocation 69. What is the prognosis of translocation 69 in AML? It has a poor prognosis, with a high white blood cell count most predictive of a shorter survival. FLT-ITD mutations are also common in translocation 69. What two genes are involved in AML with inversion 3? AML with inversion 3 results in the oncogene MECOM repositioned near enhancer GATA2. Aberrant expression of CD7 is seen in what AML-associated translocation? Aberrant expression of CD7. Megakaryocytic differentiation is seen in which AML-associated translocation? Translocation 122, resulting in the fusion of RBM15-MKL1. The megakaryocytic differentiation can look similar to acute megakaryoblasttic leukemia, so it is important to be able to differentiate the two based on the translocation. Translocation 122 responds well to chemotherapy. What BCR-ABL transcript is most common in AML with BCR-ABL? The P210 transcript. Be able to differentiate this transcript from the one associated with ALL, which is the P190 transcript. What is the prognosis of AML with BCR-ABL? Poor prognosis with poor response to tyrosine kinase inhibitor therapy alone. What is the morphology of AML with ANPM1 mutation? AML with ANPM1 mutation tends to have cup-shaped nuclei. They frequently have myelomonocytic or monocytic features. They also generally have a normal karyotype and a favorable prognosis. Which AML mutation should raise concern for the possibility of a germline mutation? AML with B-allelic mutation of CEBPA should raise the possibility of a germline mutation. There is no distinctive morphology associated with CEBPA-mutated AML, however clinically there tends to be higher hemoglobin levels, lower platelet counts, and lower LDH levels. As a note, CEBPA is a GC-rich gene which tends to have low coverage on next-generation sequencing and often requires separate testing and/or confirmation. I hope you enjoyed this video. To get updates when similar videos become available, please consider liking and subscribing.